High blood pressure and hypertension. We hear those terms frequently, but did you know it's often called the silent killer? And you could be at risk. So with us today to talk about high blood pressure is Cone Health cardiologist and clinical integration officer for Cone Health Center for Health Equity, Dr. Kardie Tobb. All right, so let's just start off with this about how concerning high blood pressure is and what are the dangers and complications from it.
Yeah, thank you for having me. High blood pressure is very concerning. The reason why you just mentioned high blood pressure is a silent killer. So a lot of times people don't know that they have high blood pressure because they've never been screened, never had their blood pressure checked. Without being diagnosed with high blood pressure or hypertension, there are complications over the years with significantly high blood pressure people can really have in terms of kidney failure, in terms of strokes and heart attacks. So that makes it concerning because it's not a symptoms that we'll see that tells you that, oh, you have high blood pressure. You can go with it for years. So that's why screening is important.
Okay, and let's talk about that. So some people may say, okay, well, I'll get screened if I'm at risk. So who is at risk for high blood pressure?
So it's important for people to know who's at risk for high blood pressure. The first thing you start to think about is age. Age is a big factor because as we get older, our risk for high blood pressure starts to become an issue because the vessels are stiffening. The other thing is race. A lot of Black people will have high blood pressure at a younger age and will develop it that is not really, they haven't been screened for it. And the other thing is family history. The one thing I want to stress, if a family member have high blood pressure, brother, sister, mother, father, your chances of getting high blood pressure is higher. Eating a lot of salt, some people will say sodium, causes increase in blood pressure because what it does, it increases the fluid in the body and that follows with the high blood pressure. Not exercising, that's one more thing. Lack of exercise increases that risk, which leads to also people who are obese, meaning that you're overweight. That increases the risk for high blood pressure as well. People who smoke, people who drink a lot of alcohol. So those are the things that people who are experiencing that or having these issues will likely have high blood pressure at some time in their lifespan.
Okay, gotcha. All right, so what about, let's talk about specifically the impact or the risk for women versus men.
I am glad we're talking about this because that impact is different. When it comes to women versus men, women at the age of 65 more women would develop high blood pressure than men. However, though, the one thing I also want women to know, and I stress that in the patients that I take care of, is in the reproductive years, there are some things that are going to expose a woman to high blood pressure that is not on their male counterparts. In pregnancy, when a woman has stress in pregnancy, they can develop what we call gestational hypertension or gestational high blood pressure. The other thing is when they develop what we call preeclampsia. So during those years, when they develop that, it increases their risk for high blood pressure. So we watch them closely, not waiting for the age of 65 where they've lost the estrogen protection and develop more high blood pressure. So that is a big issue that we really face, and I try to educate my patients a lot of times because I also specialize in what we call cardiac obstetrics with reproductive age women and tell them and say, listen, you are having this now that increases your risk for high blood pressure.
I see. Okay, gotcha. All right, now if someone isn't checking their blood pressure on a regular basis, and what's a regular basis? Maybe we should talk about that too. How might they have their high blood pressure checked?
So it's very important that every adult person who's over 18 really get their blood pressure checked. If there's no family history, think about those risk factors that I stressed earlier. If it's not there once a year, it's important to know your numbers. Get that blood pressure check, know it's less than 130/80. That's the number that we really look for. However, though, if you're in that high risk category, where meaning that you are a person that is Black, meaning that you have a family history of high blood pressure, you smoke and you drink a lot of alcohol, your lack of exercise, I would recommend trying to get that done 3 or 2 times a year to make sure that you have not developed high blood pressure. As we mentioned earlier, if you don't screen for high blood pressure, the complications are very bad. The high heart attack, the kidney failures, the strokes. So those are the things that everybody wants to avoid. So making sure screening in those high risk population is important.
Okay, and so speaking of that, sometimes it's not just convenient to go get your blood pressure checked, or you don't want to pay for a doctor's visit or something of that nature. Cone Health has something going on Saturday that includes many free screenings.
Yes. So on Saturday, we're very, very proud and very excited to share with our communities that we're coming back with our second year for our Building a Better You. This is a health and wellness screening. So at that screening, we're going to have blood pressure screening. We're going to have diabetes screening, cholesterol screening, screening with mammograms, just overall also looking at under-resourced areas, what we call the social determinants of health, because that impacts health as well. So we want to make sure our community is aware of what these things are. But really, really, I want to stress that the screenings, just knowing what your numbers are, coming and getting your blood pressure checked, and think about what I said. Looking at your family history, that's very important. Making sure that if you smoke, please be there, because it's going to really change the outcome of what your health is in 5 or 10 years.
Okay, and so it is this Saturday from 11 to 3. Do they need to register ahead of time, or can they just show up that day?
People can actually show up. There's registration, but we're going to be welcoming everyone. People can show up, get registered that day, get your screening done, encourage your family members to come out with it. And we have things for the kids as well. So it's a whole family affair. We make sure that we've got information for the children, the health. We've got information for the parents as well. So everybody just take a few hours, come get screened, because it's going to really change the outcome. You may say, well, I don't have those risk factors, but we actually have something too, because people are living with food insecurity. People are living with housing resources that don't have that information. So there's everything. There's something for everyone in terms of how it impacts your health.
Right. Let's get on this. If someone is identified as high risk for blood pressure at the event that we just talked about that's going to happen on Saturday, what would be the next steps?
So there are many things that we're going to do, one of which is connecting people to care. So when you come out and you get your blood pressure checked, if it's outside of the range over 130 over 80, the first thing we're going to make sure that, do you have a primary care provider? And right there at that event, we're able to connect people to care. So if you don't have a primary care provider, we really want you to come out, because we have that ability to connect you to care. We have that ability to make sure you are seen within a timely manner. So it's going to be something that we're not going to leave you unattended. We're going to make sure that you get that. We're not be prescribing medications that day, unless if we have a physician on one of our mobile medicine thing, which we're planning to do, and make sure we get all of that in place. So please come out, because if you don't know what you have, there's no way we can treat you. Hypertension is a silent killer, as we said. The complications can come after the damages have been done. So let's get you screened. Think about the high-risk people I mentioned. If you smoke, if you have family history, if you use a lot of salt, meaning increased sodium, if you like exercise, please come out, because we really want to make sure our communities are healthy, and just do it for the years to come.
All right, when we talk about high blood pressure, a lot of times people have medication that they use to keep it under control, but there are things that we can do to delay needing that kind of medication or reduce the amount of medication. Let's talk about those things.
So what happens when you get elevated blood pressure? It could be anywhere between 129 to 130, or a little bit over 130. It's usually a discussion with your provider. So sometimes when you're over 140 or over 160, it's really hard to say use other mechanism, because at that time you really need the medication to avoid damages. But when you're elevated, not over what we call stage 1 high blood pressure, we really talk about exercise. We talk about cutting down on the salt. We talk about eating healthy fruit and vegetables. We talk about managing your stress. What does that look like? We talk about cutting back on alcohol. So lifestyle modification, we call that. Working closely, though, with your provider and making sure that they're checking your blood pressure as those things go along. But there are times where we cannot delay medication starting, because the blood pressure is so high, and if we delay that, complications and damages could be done to the heart that we can't really repair or come back and fix things like that. So those are the things that I really want to stress, that you can do lifestyle modification, but it really is a discussion with your provider as well.
All right, so often we have some friend of the family or whatever that has a blood pressure cuff, and so they may be talking about it. We may take our blood pressure there, or we may get it done at the CVS or something like that. If we do something like that, what's the normal level that we're looking for?
Ideally, we want the blood pressure to be less than 130/80. The closer to 120, the better. If it's less than 130/80, that's good. If you go for the first time, it's over 130/80. Try to get it 2 separate times. Those 3 times when they're high, you really do have a diagnosis of high blood pressure. If you don't have a provider, you want to really make contact and get a primary care provider. If you do, you really want to stress with them that this is what you've been doing in your setting and that's the number that you're getting, and they can recheck with you. And if you're going for that recheck, bring the machine with you, the blood pressure cuff that you're using at home, so they can be able to cross-check it to make sure, number one, the batteries are good, it's working, and really see that you're using good techniques on getting your blood pressure done.
Well, speaking of that, should you put it on one arm versus the other? Should you be standing when you check your blood pressure? Should you be sitting?
Ideally, you should be sitting legs uncrossed. You can use either arms, but left arms a lot of times. Make sure that you have not had cigarettes within 30 minutes or alcohol. Make sure when you first sit down, you rest, calm down. If you sit down, usually 5 minutes, and then you get that blood pressure done. But definitely you want to do it before you eat, not necessarily after. So those things affect the physiology of the vessels and the blood flow, which can also affect the blood pressure. So you want to do all those things. Be in a very nice, calm, relaxing environment when you do that. And when you do that, like I said, 3 times you really experience that. However, though, if it's 160/80, please don't wait 3 times. Connect with your primary care provider. If you don't have one, on our website for our PCPs, you're able to have open schedules to get primary care provider and come out on Saturday.
Right, and we've got a little bit less than a minute. I'm just wondering, what is the blood pressure reading that you should call 911 immediately?
I would say over 180 systolic and 110, please call 911 and make sure that you're being taken care of, because at that point you want to get it rechecked immediately and you want to be able to get taken care of.
Gotcha. Okay. Well, as we are going to throw to the break, let's put up that information one more time. It is Saturday. That is the free clinic. It's going to be 11 to 3 at the Corbett Sports Center.